Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist treats a patient with a full thickness wound that is intentionally left open to heal. The approach was necessary due to significant tissue loss and jagged wound edges that could not be approximated. What type of healing is best described by this description? Option 1, primary intention. Option 2, delayed primary intention. Option 3, secondary intention. Option 4, tertiary intention. Healing by intention refers to the method by which a wound heals. Wound characteristics such as etiology, depth, border integrity, and wound bed contamination are typically considered when determining which closure method is most appropriate. Let's explore each of the options. Option 1, primary intention. Healing by primary intention is most commonly associated with acute wounds which have minimal associated tissue loss. For example, surgical wound, laceration, puncture wound. In these wounds, clean edges are reapproximated and closed with sutures, staples, or adhesives to facilitate reepithelialization. Option 2, delayed primary intention. Healing by delayed primary intention is most commonly associated with acute wounds that have minimal associated tissue loss but are at high risk for developing complications, for example, infection or dehiscence. These wounds are temporarily left open until risk factors have been alleviated and then are closed by usual primary intention methods. Option 3, secondary intention. Healing by secondary intention is most commonly associated with wounds that have significant tissue loss, necrosis, or borders that cannot be reapproximated. For example, full thickness wound, pressure ulcer. These wounds are left open and typically require specialized dressings and ongoing wound care to facilitate healing. Option 4, tertiary intention. Healing by tertiary intention is synonymous with healing by delayed primary intention. Risk factors such as wound bed contamination, infection, and significant local edema increase the risk of healing complications and must be addressed before the wound can be appropriately closed by usual primary intention methods. The correct answer is option 3. Let's explore the all-student data. 12% of students selected option 1, primary intention. 24% of students selected option 2, delayed primary intention. 52% of students selected option 3, secondary intention, the correct response. 12% of students selected option 4, tertiary intention. System classification. This question is another systems question, which represents approximately 21% of all exam items. Content outline classification. This question is a Foundations for Evaluation, Differential Diagnosis, and Prognosis question, which represents approximately 33% of all exam items. Level classification. This question is a Level 2 question, since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of Level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Academic focus area. Looking to review related academic content? Check out pages 512 through 513 in PT Exam the Complete Study Guide. Thanks for joining us on the Score Builder's question and answer video session. See you next week.